In a physical examination, medical examination, or clinical examination, a medical practitioner examines a patient for any possible medical signs or symptoms of a medical condition. It generally consists of a series of questions about the patient's medical history followed by an examination based on the reported symptoms together. The medical history and the physical examination help to determine a diagnosis and devise the treatment plan. These data then become part of the medical record. The routine physical, also known as general medical examination, periodic health evaluation, annual physical, comprehensive medical exam, general health check, preventive health examination, medical checkup, or simply medical, is a physical examination performed on an asymptomatic patient for medical screening purposes. These are normally performed by a pediatrician, family practice physician, physician assistant, a certified nurse practitioner or other primary care provider. This routine physical exam usually includes the HEENT evaluation. Nursing professionals such as registered nurse, licensed practical nurses can develop a baseline assessment to identify normal versus abnormal findings. These are reported to the primary care provider. If necessary, the patient may be sent to a medical specialist for further, more detailed examinations. The term is generally not meant to include visits for the purpose of newborn checks, pap smears for cervical cancer, or regular visits for people with certain chronic medical disorders. The general medical examination generally involves a medical history, a physical examination and sometimes laboratory tests. Some more advanced tests include ultrasound and mammography. If done for a group of people, the routine physical is a form of screening, as the aim of the examination is to detect early signs of diseases to prevent them. Although annual medical examinations are a routine practice in several countries, unspecified examinations are poorly supported by scientific evidence in the majority of the population. A Cochrane collaboration meta-study found that routine annual physicals did not measurably reduce the risk of illness or death, and conversely, could lead to overdiagnosis and overtreatment. However, this article does not conclude that being in regular communication with a doctor is not important. Simply that an actual physical examination may not be necessary. Some notable general health organizations recommend against annual examinations and propose a frequency adapted to age and previous examination results. The Specialist American Cancer Society recommends a cancer-related health checkup annually in men and women older than 40, and every 3 years for those older than 20. A systematic review of studies until September 2006 concluded that the examination does result in better delivery of some other screening interventions and less patient worry. Evidence supports several of these individual screening interventions. The effects of annual checkups on overall costs, patient disability and mortality, disease detection, and intermediate endpoints such as blood pressure or cholesterol, are inconclusive. A recent study found that the examination is associated with increased participation in cancer screening. Some employers require a mandatory health checkup before hiring a candidate, even though it is now well known that some of the components of the prophylactic annual visit may actually cause harm. For example, lab tests and exams that are performed on healthy patients, overdiagnosis, wrong diagnosis and harm, or even death, resulting from unnecessary testing to detect or confirm often non-existent medical problems or while performing routine procedures is a follow-up after screening. The lack of good evidence contrasts with population surveys showing that the general public is fond of these examinations, especially when they are free of charge. Despite guidelines recommending against routine annual examinations, many family physicians perform them. A fee-for-service healthcare system has been suggested to promote this practice. An alternative would be to tailor the screening interval to the age, sex, medical conditions and risk factors of each patient. This means choosing between a wide variety of tests. The routine physical is commonly performed in the United States and Japan, whereas the practice varies among Southeast Asia and mainland European countries. In Japan, it is required by law for regular working employees to check once a year. with a much more thorough battery of tests than other countries. The roots of the periodic medical examination are not entirely clear. They seem to have been advocated since the 1920s. Some authors point to pleads from the 19th and early 20th century for the early detection of diseases like tuberculosis and periodic school health examinations. The advent of medical insurance and related commercial influences seems to have promoted the